My name is Melinda Coker, and I am a radiologist, specifically a breast imager at CHRISTUS Trinity Clinic. I am from Portland, Tennessee, a small farming community in Middle Tennessee. And I think at most there were maybe 5,000 people in the town growing up. Now there's maybe 10,000 people. We had one traffic light when I was growing up. Lots of farmers, teachers, preachers, a really wholesome, family-oriented community. Probably my parents, because they always encouraged me to work hard and do my best, and then my children and my husband, because they kind of focus my priorities when I'm not at work. I've always been a visual person, and before I ever knew I wanted to do medicine, I knew I liked radiology, because you're looking at images of patients, scans of patients, at normal anatomy, at abnormal pathology, and you're not quite like a surgeon where you're in the midst of it. You're standing in a surgical room or an operating room, but you're working with technology on computers, and there were a lot of improvements in technology and computers at the time when I was in college, and so I just did some shadowing and explored different options. I was interested in pharmacy and other aspects, and I felt like medicine as a whole really encompassed a lot of the things I was interested in, and radiology is so visual. A picture can say 1,000 words. Radiology is unique in medicine because you're a lot of times working behind the scenes, or you're working with other doctors. But within breast imaging, you really get to work closely with patients as well as with other doctors in the multidisciplinary meetings, and then with patients doing biopsies. I love how you get to pull all of those different elements together as a breast imager. Plus, being a woman, I love identifying with other women. First of all, respect, and second of all, education. Education allows patients to make the best decisions they can for themselves, and the patient is always the expert of their own body. No one knows their own body the way that individual patient does. And if you can just give them the information that they need to make the best decision they can for themselves at that point in time, and then respect whatever their decision is, I think that's the best thing a doctor can do for a patient.